Hey YouTube, this is Catching Up with Crystal. Can you keep up with me? Because you never know where I'm going to be. And today I'm coming to you from my clinic. I just wanted to give a quick overview for those of you who are new to DOT physicals. The DOT commercial driver's license physical is required for drivers who drive vehicles over 10,000 pounds or for vehicles that cover more than or carry more than 15 passengers. So the medical examination is performed by advanced providers, doctors, nurse practitioners, physician assistants, chiropractors, those who have completed the FMCSA certification examination. When the driver arrives, you should request a copy of their current driver's license so that you know that they are the person who is in front of you requesting the physical. Make a copy of it and place it on their chart. Look at the latest or their last medical certification if you have it on file, so that you can make comparisons to what your findings are today. So the driver is responsible for completing the sections on the application. I do have another video on my channel. Look it up of what the application looks like. They are responsible. I actually have one in my office. So the driver is responsible for completing this section here and this section here. My other video shows that the driver completes the blue section and you, the practitioner, does the green section. Okay, review any yes questions that the driver has answered. You want to know about potential hazardous medications that they're on. Review their health history. Make sure you're asking questions even about over-the-counter medication. Benadryl is over-the-counter. It'll make you sleepy. You want to take all of those things into consideration. Section 3 has to do with the vision, that tests the acuity when the visual fields, the color vision, and you want to make sure that they are able to differentiate between green and red. If their vision is less than 20/40 in either eye, then this requires a referral. And so they would have to go to the MVA and follow those guidelines. The doctor's information should be filled out on the form, and it should include their driver's license, phone number for the doctor, and make sure that everything is legible if they're clearing them, okay, or if they have some kind of waiver. Anybody who can only see out of one eye is automatically, not necessarily, but if they only have one eye, then they have to apply for a waiver, but you cannot qualify them. They can apply for a state waiver, but you cannot qualify somebody who can only see out of one eye. Section 4 of the application has to do with hearing. You can do what's called a whisper test, where you actually literally have the patient, and I demonstrate that in another video, where you have the patient tell you what words you whispered. You're going to turn away from the patient. 5 feet away is what they must be able to hear you at. You whisper something, have the patient repeat what you said. It is okay if your patient has a hearing aid. That does not automatically discredit you or disqualify you from passing. You can have a hearing aid. Only one ear needs to be able to hear at 5 feet. Okay, if for some reason they fail the whisper test, then you have to refer them to have an audiometer. They must have an average hearing loss better than no less than 40 decibels. Section 5 is the blood pressure reading. You want to take a blood pressure. If that first blood pressure is too high, then you want to let them rest and relax, because this is stressful, you know, and take it a second time again. Now, if the second reading is out of range, you do have some flexibility and leeway. You could tell them to go get on some medication and come back in 3 months, or come back when, they've started their medication, or come back after whatever it is your recommendations are. Section 6 has to do with doing a urinalysis. You want to get a urine. It's not a drug test. That's not your business or your problem. The drug test is for the company that hired them. The urinalysis, what you're looking for is the specific gravity. You want to document that, any protein or blood or sugar in the urine. And if their urinalysis is abnormal, you do have some discretion of whether or not to qualify them for fitness of duty. Now, the maximum certification period is 2 years. If they have a chronic medical condition, you can use your clinical judgment whether or not they're able to drive safely or not. So you can certify them for a shorter period of time other than 2 years. You can certify the driver for 1 year or 6 months, or have them follow up, especially if your findings are hypertension or diabetes, as long as they're not on insulin and as long as they don't have multiple cardiac risk factors. Now, the hearing test we went over. So you want to perform a whisper test again at 5 feet. If they don't pass, then you have to do the audiogram. That's where they put the hearing test. We all did it when we were kids. It's a hearing test. You say where you hear the tone. Average hearing loss of more than 40 decibels in the better year that is not corrected cannot be cleared. If they are on insulin for diabetes, whether type 1 or type 2, the driver must try to get a waiver. Do not certify anybody that has seizures or epilepsy unless they've been off of their anticonvulsant medication and have been free of seizures for 10 years. You cannot certify any driver that has a history of severe brain injury or early seizures. As far as the blood pressure goes, a BP greater than 180 over 110, do not clear them. Do not clear them. You will see blood pressures this high and higher. Do not clear them. You cannot clear them until they at least get to 140 over 90, and then you can only clear them for 6 months. You want to refer them for blood pressure medicine, have them come back, and that's only if that is their first time coming to you, or this is their first time that they're out of range. For BP greater than 160 over 100, you can clear them one time for only 3 months, and then they have to follow up in a year. If it's less than 140 over 90 after 3 months, then do not clear them. I hope that I'm not confusing you with that. Blood pressure greater than 140 over 90, clear only for 1 year. Don't give them a 2-year certification. Clear for 1 year and have them follow up. Also, if they have a current issue with substance abuse, if they're alcoholic, if they have a defibrillator, if they're using methadone or marijuana, do not clear them. If they have a history of a heart attack, do an EKG and rule out that there's an issue, and there's a minimum period of 2 months. They have to have a waiting period of 2 months after they've had a heart attack. That doesn't seem like a lot of time, but that's what the regulations are. What else? If they have psychiatric issues like they're bipolar or a mood disorder, major depression, and schizophrenia, that requires 6 months of being symptom-free. They have to have a waiting period of 6 months symptom-free following a following a non-psychotic episode. And I guess any medications that'll alter the conscious, your ability to make decisions, your ability to react quickly, do not clear these people. And then when you do all of that, you want to make sure when you're doing a physical exam that they have the ability and the strength to stop that truck. Make sure that you are assessing their range of motion, their strength, and their coordination. That's very important. After you do all of that stuff, then you can pass them. You can print out, you go to the website and the FMCSA website, and you can provide, you put in the information and provide the driver with a copy of the certification. It's their responsibility to take it to their own motor vehicle department. I hope that this has been helpful. It was maybe seemed a little confusing the way I ran it down. I just was trying to give you some tidbits. If you have any questions, put them in the comments. This has been Catching Up with Crystal. You have caught up with me in my clinic, and today we have discussed the FMCSA, how to do a DOT commercial driver's license physical. Please hit that bell notification so you know when new content is posted. Please like and subscribe to my channel. Again, if you have any questions, put them in the comments. I do respond. Thank you so much, guys. I'll see you in the next video.